Nebraska families say a change on the state level left them scrambling to care for their loved ones with special needs.
Nebraska Health and Human Services no longer pays those families to provide day services in the same home.
KETV News Watch 7's Andrew Ozaki investigates why the state made the change this year.
A party at Dave & Buster's with friends for Isabella Powell. Outings like this Monday through Friday help the 27-year-old with special needs be a part of the community.
But it's really important to their overall well-being to be out in the community and just to be inclusive.
And since COVID, her adoptive father, Mike, has been her day service provider. He takes her to volunteer at places like a farm or a food bank.
In the past, when she had the service outside of our home, that there was a lot of emotions and things that we basically weren't there to help her through.
The state is paying him $14 an hour. That allowed him to quit his regular job, which was a pay cut, but it was better for Isabella.
One of our caseworkers suggested that my husband do her day service program.
But in November, the family was notified DHHS would no longer pay for those services to anyone living in the same home.
We have a doctor's note, and like I said, none of her care team agree with this decision whatsoever.
It left an estimated 187 families scrambling to find alternate services, says Mandy Wilson, who is part of a family support group.
Sometimes that whole process could easily take 60 days by itself, sometimes 90, especially with the crisis of the short staff problems that Nebraska is currently seeing.
We took those concerns to DHHS and received this statement. Part of the reason these changes are being made is to make sure DD waiver services follow federal rules that require states to ensure participants are integrated into the community as much as possible for that individual. The statement also adds, these changes will ensure that adequate supervision by the shared living provider can be maintained for all persons in the home, including biological children, family, improved access to community, employment, and other human interaction, and ensure a shared living provider has a break and is not technically in a paid status 24/7. DHHS said they began notifying provider associations in late September.
We're being told there is no appeals process.
This family says they will not go back to taking Isabella to an institutional day service she didn't like.
If something's really working for each individual, and since it's supposed to be person-centered care, that we can't just make a rule for every single one. There has to be individual needs looked at.
Andrew Ozaki, KETV News Watch 7.